generally speaking, the whole experience has been a great one with us. When making our decision to go partially self-funded or not, or to go back with a fully covered, we had some experience that enabled us to go to the self-funded and partially self-funded. And the reasons that LifeWell was a good solution for us was the flexibility. They came in and asked us what we wanted, and that whatever we didn't have or didn't see on the table, they were able to come forward and provide that for us and give us the solutions we asked for. They were responsive. The issues that we've had, which are minimal, they have jumped on very promptly and gotten back with us. Staff is very good. They have been in a more aggressive mode to be customer service driven than some of our prior experiences that we've had. The data was a big part of that. We needed to make good decisions, and we needed to determine what we were going to do with our benefits and what we offered, what we cut back on, what we expanded upon. And in order to do that, we needed that data in order to make sure that what we decided upon was good information, and access to that was just very difficult to get. And I work off of data. I like to see information. I like to see the statistics. I like to know what benefits we're providing. Obviously we can't look at the protected data, but we can look at trends, like we're having more structural claims, or we're having more circulatory claims, or liver related, or what have you, and then make our call based on those, and whether we raise a copay or drop a copay or drop a coverage if it's not being used. We've done that, and so having that data that we could get through LifeWell and the claims, through the claims process, enabled us to make a lot better decisions. Well, we have a small shop, HR area. We just have 2 employees, and they cover the whole gamut of HR, compensation, benefits, the whole realm of that function. And with 2 people, that's stretching it. The experience that we have had with LifeWell and the other providers in our partial self-insured program is that they take that off of us. They take that load off, and employees have a card that says, if you have a problem, call this person, call this number, and they do. Our open enrollments have been very, very smooth. People are used to the process. They are used to the people. We call one person when we call, and that individual is the link. And they don't call on Monday and get one person, and Tuesday and get another person, and then Wednesday they call about the same claim, and nobody knows about what's going on. That one person is our link and carries the ball for us. And I'd sum up the whole experience as being that they're a good partner with us.
When I come in every day, and we may have individuals with questions about their benefit health claims, or their family members even, we can simply call up LifeWell, give them the information, and they take care of it from there, from point A to point Z. So that frees us up to do more strategic planning, to get out and speak with our departments, to train more within our department. So we have a lot of time to do things that we wouldn't have time to do if we were handling the business that LifeWell handles for us.
A lot of the frustration I have, and my background is in finance and the risk management, and I hate to see dollars go out the door without some value received. And one of the things that experience that we had when we were making the decision to go partially self-insured was the prior 2 years to changing, there were cumulatively about 48% rate increases, those combined for those 2 years. We tracked it the year first year after we went self-insured, that increase would have been 45%. So we were looking at, had we continued, almost half again our cost for health care, which would have been about $1 million. And you know, this HR in the benefits area, that's a significant part of our cost beyond payroll, the regular payroll. And we just felt like we were paying money, we were paying a premium, and if we had a good year, we had no recognition for it. We had those 2 years I mentioned where there were rate increases. Our claims were way short of what the premiums were, but yet they still went up 30% one year and 45% the year. So we would have basically in those 3 years have almost paid again what our entire annual cost we had assigned for health.
LifeWell has a wellness program, so that helps us keep our city healthy and keeps our claims down. So if anyone can really be grateful about that, is the city. We are. One thing about LifeWell is their partnership with the wellness program. This is what helps us help our employees. It's not just about giving them a benefits plan and taking this home to your family and reviewing that, but it's giving them life options to be healthy, life options to deal with some of the things, some of the sickness that they may have already. The wellness program gives them different avenues to take on their life experiences. And that helps us as a city, and we can promote that health care plan to our new hires, to people who even want to come to the city. That is a great benefit, and I would recommend that for anyone.